Sorry for the interruption. Yes. Hello, good evening, everyone. Welcome to this Facebook Live, which is organized by the Endocrine Society of India. Endocrine Society of India, or ESI, is the largest professional body of qualified endocrinologists from India. So this is a part of an ongoing Facebook Live series, which is being conducted every Saturday evening to create awareness among general public about common endocrine disorders. So you might be aware that endocrinology is the study of branch of medicine which studies hormones. Hormones are messenger molecules which travel from the originating organ or gland, which is also called endocrine gland, and it travels to the its destination organ, and it controls all the bodily functions. Common endocrine organs, you might be knowing that thyroid, pancreas, or pituitary, these are all common endocrine glands. Lesser known ones like parathyroid gland is also there, which produce parathyroid hormone. So what might be interesting to know is that all other organs in our body, like for example liver or kidney or even our intestine or brain, so all these organs which perform other functions, they are also producing hormones. So they are also in a way endocrine organs. So this endocrinology is the branch of medicine which studies all these. So bones, even bones, our skeletal system is part of such a system, and that is why we are conducting an awareness session on the role of endocrinology in bone health. So this month we are conducting programs on bone health. A session on calcium and vitamin D disorders have been conducted already. So the next session is on osteoporosis. Osteoporosis is a disorder of the bone. To know more about osteoporosis, you might have heard about the term osteoporosis. It means weak bones or porous bones which have holes in them. So to know more about them, we have, I'm a consultant endocrinologist. I'm Dr. Vishnu Vasudevan. I'm practicing in Kerala. And we have our esteemed faculty members who are all endocrinologists from various parts of the country, who will be talking about this common disorder called osteoporosis and the importance of osteoporosis. So we have Dr. Thomas Paul. He's the head and professor of Department of Endocrinology, head of the department at CMC Vellore, Christian Medical College Vellore, which is the largest institution in southern India. He has a wide research interest, and particularly on disorders of bone, osteoporosis. Sorry for the interruption. So I hope I was audible, and I've introduced Dr. Thomas Paul. He is the head of the Department of CMC Vellore. Next esteemed panelist is Dr. Achoba Singh. He is Professor of Endocrinology at JNIMS Imphal, Manipur. His research interests also include various endocrine disorders, including bone disorders, and he has publications in the area of bone disorders. Welcome to you, sir.
Thank you.
I would like to next introduce Dr. Pradosh Gangadhar. He is a senior consultant endocrinologist. He is from Kerala. He is working presently at ICRA International Hospital, Calicut, Kerala. He was trained from the prestigious PGIMER, which is the largest endocrine training center in North India, Chandigarh. And he has also had various research interests in vitamin D disorders, metabolic bone disorders, osteoporosis, and fracture risk prediction. Welcome to you, Dr. Pradosh.
Thank you, Dr. Vishnu. Thank you.
And our last panelist is Dr. Debrati Bar. Dr. Debrati is a tutor. She is a consultant endocrinologist also working in RG Kar Medical College Hospital, Kolkata. She he has a huge academic interests, and she has also has publication in the area of vitamin D therapy related to thyroid dysfunction. Her research interests include a rare disorder of endocrine condition which is known as pheochromocytoma. I welcome Dr. Debrati to the program.
Thank you, Doctor. Thank you.
So that we have all our panelists here. I will invite one by one to know more about this condition called osteoporosis. So the first question will be to Dr. Pradosh. Dr. Pradosh, what is osteoporosis? What do you mean by this term osteoporosis, and how common is this condition?
Thank you, Dr. Vishnu. Osteoporosis is a very common condition affecting the bone. It's characterized by brittle bones that are getting fractured very easily. You will get very easy fractures with trivial trauma. And as we all know, the bone is composed of minerals and organic matrix. And mainly we know that minerals constitute calcium and phosphate, and then we have the collagen, which is the important protein, and this give the bone the strength and the density. That's what we are very much aware. And osteoporosis is a condition where the bone formation and bone removal balance is actually loose. So ideally, there is a cycle going on in each bone where individual's bone will have bone formation and bone removal process will be balanced. When this balance is lost, when the bone removal is happening more, then we will call bone is losing strength, and one person get osteoporosis. It's a very common disease, as we know. Around 50 million people are there in India in 2013. They are suffering from osteoporosis, and of which many are untreated or undiagnosed. And not only that, if you look at the International Osteoporosis Foundation data, 1 of men who are aged more than 50 years has osteoporosis, and 1 out of 5 males who are aged more than 50 years has osteoporosis.
So yes, thank you, Dr. Pradosh. So you mean to say that osteoporosis is a very common disorder? It can affect elderly individuals, and especially now that we are going to surpass China very soon in the number of people next year, probably 2023 or 24. And it is being said that demographic transition is happening so much that within next 1 or 2 decades our population will also age, and a huge number of people will be there in your bracket which you are saying more than 50 years. So they will be all be at risk of this condition of osteoporosis. So that's a really dangerous condition. Yes. So my next question is to Dr. Singh. Dr. Achoba Singh, when do doctors suspect this disease? When can we suspect, or when does the person go to the doctor, and when does doctor suspect this disease, this condition?
Okay. Thank you, Dr. Vishnu. Uh,
it's a very difficult question for me as well, and it would be quite difficult for others too. I think osteoporosis is a silent disease. Never know any individual is having some osteoporotic disease. And to know it, we have certain issues and certain indications that we have to suspect. And as a doctor, we have to have certain preformed data, and we have to suspect what are the risk factors. I have to focus on risk factors first. Those having it's already known by everybody. It's not very difficult to know, but only things that we have to exercise the algorithm, that when any person coming to our clinics, I have to suspect something of the nature. And having said that, this having gender like female, then the aging, then the like lifelong uh, nutritional deficiencies and habits like taking too much of alcohol and comorbid conditions, and like those who are requiring some long-term therapy with glucocorticoids, say more than 3 months, they are usually have certain indications for having silent osteoporosis, because we never know when the pain occurs. Then only we focus. Somebody is saying that I have hip joint pain, I have backache. Then only we start suspecting that something might have gone wrong on the part of the individual, like could be a fracture. When there is a fracture, there is the end point of the diagnosis, because before that it's quite difficult, because we have to take many factors, many risk factors into account, so that we can have a strong index of suspicion. And that's how I would impart this message to all, that we have to have a high index of suspicion based on certain risk factors that I have already alluded to. And there are some modifiable factors, some are not modifiable. For example, aging I cannot change, but habit I can change, and genetic factors I cannot change, which will occur in spite of our best effort to prevent osteoporosis. I think that way, certain diseases, comorbidity, and many other medications, because osteoporosis, apart from this primary osteoporosis, as you know, occurring in the younger age group like adolescents, there are primary osteoporosis. In the secondary factors like aging, age itself is a risk factor for osteoporosis. And I say in the female, like post menopause of estrogen deficiency, that is, as Pratos already said, the bone breakdown supersedes the bone formation. Balance is lost. So faster we lose bone. Whatever we have a peak bone formation during our adolescence, say up to the age of 26, 27, the peak bone mass reaches. And that peak bone mass which we reach in the earlier ages will be utilized for the future and to replenish the decay in the subsequent years. So I think that also would be. And if I have to say that risk factors, not to mention few, but it should take into the track long before occurring it, since childhood. As maybe somebody says that it should be tracked during even the life in utero, like mother's habit accounts for that. So there is something changes. So I think risk factors we have to have till the time patient has fractures and coming with pain, then we have to suspect all these things. So in the clinics, sitting in the clinics, and we have to have a detailed physical examination, and we have to have a detailed history, and most of the this will give us a light to the presence of index of this osteoporosis suspicion. I think so.
So, thank you, Dr. Singh, for the introduction. Nice way in which you talked about how doctors suspect this disease. But what I could gather from your speech was that there are many risk factors which are modifiable or non-modifiable. So some things like aging, we cannot, as you
Yes.
rightly said, we cannot change anything about that. But for
Yes.
example, vitamin deficiency or calcium deficiency, these modifiable things we can change, and our habits, more and more of exercise, giving exercise to the bones and muscles are around surrounding it. These are all ways
Yes.
in which we can prevent fractures, and so that's what I could gain from your. Thank you for that.
Okay.
Now I will go for the third question, and this is to Dr. Debrati. Uh, she will be talking about more about the causes of osteoporosis. Could you please elaborate the causes of osteoporosis? Why does this condition happen to anyone?
Yes, thank you, Dr. Vasudevan. As has already been discussed by our panel, osteoporosis, which is a defect both in the bone quality and the bone quantity, may be a primary disease or it is secondary to some underlying causes. प्राइमरी कॉज में हम जो समझते हैं, एक्चुअली ये डिजीज जो होता है आफ्टर मेनोपॉज, जब एक्सक्यूज मी, आफ्टर मेनोपॉज लड़कियों में मतलब बूढ़ी औरत में ये ज्यादा देखी जाती है, एंड दैट इज द प्राइमरी कॉज ऑफ ऑस्टियोपोरोसिस बिकॉज ऑफ द विड्रॉल ऑफ द गोनाडल हार्मोन्स, और हमारे सेक्स हार्मोन्स जब हमारे शरीर से कम हो जाते हैं तब बोन्स विल बिकम फ्रेजाइल, वो फ्रैक्चर प्रोन हो जाते हैं, and it is the beginning of osteoporosis which starts even at the menopausal transition, and also elderly men after age of 65, जो अगर कोई ज्यादा अल्कोहल लेता हो, स्मोकिंग ज्यादा करते हो, जिनमें किसी भी कारण की वजह से कोई भी स्टेरॉइड का डोज, प्रेडनिसोलोन का सपोज डोज 5 मिलीग्राम से ज्यादा हो रहा हो, एंड इट इज गोइंग ऑन फॉर मोर देन 3 months, you are taking that steroid. So these are the risk factors which will predispose to osteoporosis. But apart from that, aging की वजह से जो osteoporosis हो रहा है, उसके अलावा there are several secondary causes of osteoporosis जिसमें bones के underlying disease होते हैं, and these diseases may be numerous. बहुत सारे causes होते हैं, endocrine causes, क्योंकि हम लोग endocrinologists हैं, फर्स्ट डिस्कस करते हैं, जिसे डॉक्टर विष्णु ने शुरू में बताया. The gland parathyroid itself secretes a hormone, parathormone, जो bones को strong बनाते हैं, but excess of parathormone, hyperparathyroidism is too dangerous, it can cause fragile bones. उसके बाद thyroid का बीमारी बहुत common है, लेकिन thyroid excess हो जाता है जब, like thyrotoxicosis. Similarly, gonadal hormones not only after aging की वजह से नहीं, लेकिन कम उम्र में कोई भी वजह से जेनेटिक डिफेक्ट हो सकता है, एंजाइम डेफिशिएंसी हो सकता है, रिसेप्टर के डिफेक्ट्स हो सकते हैं. इस वजह से अगर हाइपोगोनाडिज्म आ जाता है, कोई भी एंडोक्रिनोलॉजिस्ट हाइपोगोनाडिज्म बच्चों में भी डिटेक्ट कर सकते हैं, जो बहुत लंबे होते हैं, दे हैव अ टॉल स्टैचर, हाथ पैर ज्यादा लंबे होते हैं, इमैच्योर फेसिस होता है, जिसमें एडल्ट का फीचर्स जो हमारे सेकेंडरी सेक्सुअल कैरेक्टर्स पीबर्टी में आते हैं वो नहीं होते. इस तरह से बीमारी में हो सकता है कि आपके बोन्स भी उतने ही फ्रेजाइल हो, बिकॉज द गोनाडल हार्मोन्स और सेक्स हार्मोन्स आर लैकिंग इन देयर. सिमिलरली ग्रोथ हार्मोन जो हमारे हाइट को बढ़ाते हैं, उसका एक्सेस, जैसे कि एक्रोमेगैली, कुछ लोग होते हैं जिनमें फीचर्स बहुत बड़े, लंबे नाक हो जाते हैं, लंबे टंग और जीभ हो जाते हैं, हाथ पैर बड़े बड़े हो जाते हैं, एक्रोमेगैली कहते हैं. उसमें भी इट इज सीन दैट देयर इज सम क्वालिटी डिफेक्ट इन द बोन एज वेल. ग्रोथ हार्मोन डिफिशियंसी जो बच्चों में हम बोलते हैं कि स्टंटिंग, हाइट कम है, उनको में भी देखा जाता है कि पोरोसिस एग्जैक्टली नहीं होता है वो, बट लो बोन मास इज कैरेक्टरिस्टिक ऑफ ग्रोथ हार्मोन डिफिशियंसी. ग्रोथ हार्मोन में जो कम होते हैं उस बच्चों में भी ये देखी जाती है. But not only endocrine disorders, there are several other conditions in which people suffer from low bone mass, poor bone quality. Genetic disease अगर हम बात करें जो अभी बोला गया है, these are very rare, but osteogenesis imperfecta जिसमें bones बहुत fragile होते हैं, Marfan syndrome जो में हाथ पैर शरीर की हाइट बहुत लंबी होती है, हाइपर एक्सटेंसिबल जॉइंट्स होते हैं, जॉइंट जो इजीली बेंड हो जाते हैं, जैसे कि एलर्स डैनलोस सिंड्रोम में होता है, आंख में लेंस के डिफेक्ट होता है, एलर्स डैनलोस में होता है. ये सब रेयर कॉजेज हैं. जीआई कॉजेज में जैसे कि पेट की बीमारी, जैसे कि कोई लिवर डिजीज हो जिसमें कोई मेटाबॉलिक सर्जरी किसी ने अंडरगो किया हो, गैस्ट्रिक बाईपास हुआ हो, जो मेल न्यूट्रिशन में सफर कर रहे हो, जिसमें मेल एब्जॉर्प्शन डिसऑर्डर हो, लाइक इरिटेबल इन्फ्लेमेटरी बाउल डिजीज, लाइक क्रोन्स डिजीज, ये सब डिसऑर्डर में भी बोन क्वालिटी बहुत खराब हो जाता है। इसके अलावा बहुत सारे ऑटो इम्यून कंडीशंस है, लाइक रूमेटॉइड आर्थराइटिस, सिस्टेमिक लूपस एरिथ्रोमेटोसिस, एंकाइलोजिंग स्पॉन्डिलोसिस, बच्चों में जुवेनाइल इन्फ्लेमेटरी आर्थ्रोपैथी, जुवेनाइल रूमेटॉइड आर्थराइटिस, इडियोपैथिक चाइल्डहुड ऑस्टियोपोरोसिस, दीज हैव बीन सीन। जो लोग एक्चुअली रूमेटोलॉजिकल डिजीजेस में सफर करते हैं, ये नॉट ओनली ऑस्टियोपोरोसिस एल्डरली में करते हैं, बट इन द यंग पॉपुलेशन ऑल्सो दे कैन प्रोड्यूस दिस डिजीज। बहुत एक इंपॉर्टेंट जरूरी मैसेज है कि थैलेसेमिया भी ऑस्टियोपोरोसिस या लो बोन मास प्रोड्यूस कर सकता है। सो बच्चों में थैलेसीमिया मेजर होने से ये ध्यान में रखना पड़ेगा कि बोन क्वालिटी सफर कर रहा है कि नहीं। एज एन एंडोक्रिनोलॉजिस्ट वी सी मेनी पेशेंट्स ऑफ टर्नर सिंड्रोम, we see patients of Klinefelter syndrome, we see patients of Kalman syndrome, idiopathic hypogonadotrophic hypogonadism. All these patients are suffering from sex hormone deficiency. ये पहले ही बोला गया है, these are very common causes which have ऑस्टियोपोरोसिस एसोसिएटेड। इसके अलावा कोई सेरेब्रल पॉलिसी वाला चाइल्ड जो मोबिलाइज नहीं करते, जैसे अभी डॉक्टर विष्णु ने बोला, एक्सरसाइज रेगुलरली बीइंग फिट इज इंपॉर्टेंट टू प्रिवेंट बोन डिसऑर्डर्स एंड इम्प्रूव द बोन रिमॉडलिंग। ये जिसमें नहीं हो पाता, जैसे बच्चों में कोई सेरेब्रल पॉलिसी हो, जो पैराप्लेजिया जिसके पैर की बीमारी की वजह से, कोई न्यूरोलॉजिकल बीमारी की वजह से चल नहीं पा रहा हो, जिसमें स्पाइन का कोई डिफेक्ट हो, जैसे स्पाइना बाइफिडा हो, स्कोलियोसिस हो, ये सब बच्चों में भी बोन डिफेक्ट होता है, और बड़ों में भी ड्यू टू इमोबिलाइजेशन ऑस्टियोपोरोसिस हो सकता है। अपार्ट फ्रॉम दिस, किडनी डिजीज अगर बहुत दिन से हो, जैसे क्रॉनिक किडनी डिजीज, इसमें भी ऑस्टियोपोरोसिस देखा गया है।
So that was a elaborate discussion on osteoporosis. Thank you for that, Dr. Debrati. So Debrati has made it very clear that this is not a simple condition. It's a very complicated disorder. Though the commonest cause would always be postmenopausal osteoporosis. The majority of the people who are suffering from osteoporosis, I think, would be postmenopausal women, and a single fracture happening in them will dramatically. I just had one patient today in the morning. She was walking into my OPD 2 months back, and she has got a fracture. I was just wondering whether she had osteoporosis. I was specifically not treating her for that. Had just seen her once in my OPD, but that patient was now bedridden. She has bed sores. She is completely dependent on others, and one single fracture would just make them completely. They'll lose their independence. They'll always be dependent on others, and maybe their mortality, their risk for dying in the next few years also increases so much by just having one fracture. So other causes, all doctors who are listening to this uh, should know about all other causes of osteoporosis. It's not a simple disorder. In many conditions, we miss the diagnosis of osteoporosis. So thanks for that. We'll go to the next question. It is to Professor Thomas Paul. We are all waiting to listen to him. The question I am putting forward to him are, what are the common tests to diagnose and detect osteoporosis? What are the tests which doctors order to diagnose osteoporosis? Please also feel free to correct our mistakes, and please feel free to elaborate on what the previous questions also, sir. Welcome you, sir.
Thank you, Dr. Vishnu, and it was wonderful to be a co-panelist with all of you. And it is really wonderful information we are conveying. And I think it is a coincidence that World Osteoporosis Day is going to be on coming Thursday, 20th October. So we are doing a panel on osteoporosis in this week at the Endocrine Society of India. Mohan was sharing that this is an important week because we have to remember. So, as you rightly pointed out, Dr. Vishnu and Dr. Prati, as well Dr. Singh and Pratosh, see, osteoporosis is a silent disease. So what? It has serious implication, as Dr. Vishnu mentioned. If you don't treat, it can result in fractures, where fractures of the back, that is spine, fractures of the hip, or fractures of the forearm. Next question is, so what? We have orthopedics specialists to do surgery. But as Dr. Vishnu mentioned correctly, especially with hip fracture, even the after fracture, and if the women are above 60 years, 20% will die within 1 year. Whatever orthopedics procedure you do, whatever you do treatment after sustaining fracture, 20% will die within 1 year. On the other hand, if you treat, you are able to prevent 50 to 60% of this occurrence. So we have to be aware of this silent disease. As Dr. Debrati mentioned, all the risk factors, and we have to make a diagnosis, next plan treatment. Coming to diagnosis, what do you do is somebody, say, when somebody is 60-year-old lady comes to me, the diagnosis may not be very straightforward, as Dr. Singh put it across. Simple things like X-ray of the spine, which will tell us, X-ray of the backbone will tell us whether already, you can see the X-ray and see there are already the parts of that body, the spine vertebral bodies are perfect, or they are all collapsed. Simple test. Anywhere, primary care. You are sitting in a village, you go to X-ray, the physician can refer to you to see for the X-ray. Number one. Of course, what is the ideal thing is to do a special scan called DEXA scan. Name is alarming. It's nothing but it's a glorified X-ray. Nothing to worry. It's a two X-rays are used. That's the reason called it is DEXA, dual X-ray. It will measure, Dr. Deprati was mentioning about bone quality and bone quantity, and Dr. Pratosh was also mentioning this will assess the bone quantity, what we call it as bone mineral density. And it gives us a measure, and we use certain scores called T scores and Z scores from that to make a diagnosis of osteoporosis. So this machine is very safe, and radiation is negligible. If I want to mention 100 DEXA scan, if you do, it is equal to radiation of one chest X-ray. The whole scan will take only 5 minutes. And it is so simple to make a diagnosis of osteoporosis with using the special X-ray machine called dual energy X-ray absorptiometry. It's a tongue twister, but it's a very simple machine, and it gives you the bone quantity, and we get it as a T score or Z score. In appropriate setting, the treating doctor will see what is the correct one and make a diagnosis of osteoporosis. So I told you about the X-ray. I also told you about the DEXA scan. Sometimes we have to do some special blood test like calcium, because the previous speaker was talking about parathyroid disease. There's a gland in the neck. When it functions too much, it sucks the calcium from the bone, and the bones will become brittle, thin, and they fracture. We can measure the phosphate in the blood. We can also check the vitamin D in the blood. These are the simple tests. Sometimes we have to think of cancers which can cause osteoporosis. There is a cancer, blood cancer called myeloma, which can come. They will have back pain, and sometimes we shouldn't ignore it. When you do a blood test, you may find little high calcium. Then they can have multiple fractures, many fractures on the backbone. Then When you do a special blood test called electrophoresis, we can get a diagnosis of myeloma. So many other conditions, related blood tests we can do. So these tests are added benefit for making a diagnosis of osteoporosis. Once again, I want to say the treatment is so rewarding. You know how costly is the treatment? Per year, if you make a diagnosis, if the cost of treatment, simple treatment with the calcium, vitamin D, all these things is going to cost 2,500 rupees to 3,000. If somebody sustains a hip fracture, the cost of treatment is 1 to 1.5 lakhs. So you have to remember, and all the patient will be lying down, all this. So the diagnosis is important, and then comes the treatment. Thank you, Dr. Vishnu.
So, thank you, sir, for the elaboration. And I think the message which public would have got is that osteoporosis is a very important condition which needs to be diagnosed, and treatment is very rewarding. He said about the cost of treatment, but not only the money, whatever money you spend, the suffering you have to suffer. If you are willing to spend the money, but the person who has sustained the fracture, they have to suffer. So that is the situation. So I'll go to the next question to Dr. Pradosh. What are the precautions we need to take to prevent osteoporosis?
Thank you, Dr. Vishnu, for that important question. So, Professor Thomas Paul sir already mentioned we are probably nearing the World Osteoporosis Day in October 20, and it's an apt time to conduct this kind of discussion today. And if you ask me the theme of World Osteoporosis Day, I can elaborate that, and that will tell what are the steps to prevent osteoporosis. The theme is Step Up for the Bone Health. It's a time to educate regarding osteoporosis and bone health. So there are 5 steps. One is the diet. Diet, I think we have a session, and we'll be in depth dealing with that. Balanced diet, calcium, vitamin D, supplementations, and calcium rich diet one should consume. And other second part is exercise. And exercise, most important thing is weight bearing exercise, which actually gives strength to both muscle and bone, not the usual exercises like aerobic exercises. That may not be sufficient, and actually a person has to do the weight bearing exercises. And recommended time for weight bearing exercises 2 hours 30 minutes or 150 minutes per week, and generally you can do it 4 or 5 days a week. And not only that, in elderly you have to be cautious regarding this weight bearing exercise. Actually you have to consult a trainer who is experienced with elderly, and then you have to get the exercise, and also you have to consult your doctor before going for exercise program. And most important part for the elderly is the balance training. That is very important. That actually helps them to prevent fall. And this kind of exercise, there are multiple exercises for that. This session is not sufficient to explain all these exercises, but one should ask the doctor or the trainer what are the balance training exercises for the individual, and they can take that. Now, third step is the weight. You have to maintain your weight. Ideally, if the body mass index is less than 90 kg per meter square, that's important risk factor for osteoporosis. And generally, one has to keep the body weight in the ideal BMI range. Generally, it should be between 90 to 23. That's the ideal thing to keep your weight. You don't have to become obese as well. Now, diabetes is a risk factor for osteoporosis, as we know. So we have to keep it in between. So that is one thing. And fourth is to avoid some addictions, like you have to quit smoking, and also you have to limit, if you are able to avoid alcohol, that's good. But if you're taking alcohol, limit it to minimum as far as possible. The recommendation to limit to less than 14 units per week. So finally, the fifth factor is actually you have to look at the risk factors that already Dr. Depradi explained a lot. So if you have any drugs that is contributing, like steroids or some anti seizure medications, can lead to this. And some if you're getting drugs like aromatase inhibitors like letrozole post Ciebras, or the patient has any cancer of prostate, they are getting treatment for that. These things can lead to osteoporosis, and such setting one should aware. And also the diseases, there are a lot of diseases Dr. Debrade already mentioned. You have to be careful regarding this diseases. So if you look at all this aspect, actually you can prevent osteoporosis. And another important point probably I need to highlight is the fall risk assessment. That's very important. And if you are able to assess fall risk with there are different scores to assess fall risk, and especially if the person's age is more than 50-60 years, then ideally one should assess fall risk. And if the person is prone for fall risk, you have to take adequate precautions, and they should exercise with proper instructions. They should get balanced training. They should get all the sufficient precautions to prevent fall. That's from my mind. Thank you.
Thank you, Dr. Pradosh, for elaborating the precautions needed to be taken to prevent osteoporosis. So first of all, that is the aspect we are trying to prevent osteoporosis itself. So that we in medical terms called it primary prevention. But now if you have a person who already has osteoporosis, then we are trying to prevent fractures in him. That is called secondary prevention. So I would like to ask Dr. Ashoba Singh sir to discuss about the precautions a person with osteoporosis should take to prevent fractures. So that is the final endpoint, fracture prevention.
Okay, thank you, Vishnu. Uh, in this forum, we are discussing about osteoporosis. The end result is the fracture. I hope so. And prevention of fracture is the most important. And osteoporotic patients are very prone for falls also, for the simple reason that they have weak muscles, they have deformities like spine kyphosis or decreased postural control. These are the risk factors for falls. Whenever there is a fall, there is a risk for fracture. So prevention of fracture is the utmost importance for preventing fall. And it is also known that most of the falls in the elderly occur at home, basically. So the home situation should be modified in such a way that the falls should be prevented. Like if I say the floor should be very rough type, not very slippery, and the staircases should have handrails, and the home environment should be well lighted. And these are few of the precautions that can be done at home. And the floors should be, as much as possible, should not be slippery and should not be wet. And these are the precautions at home to prevent fractures. And as for, I think most of the precautions that should be accompanied for prevention of falls and fractures, already Pratos has already highlighted, because exercise is all the more important. Just to highlight, is exercise is very important. Rather, it should be encouraged. But the thing is that the level of exercise I cannot predict. This is we have been advising what type of, if I am asked by an elderly how much should be the exercise to be done, then I would rather suggest to the maximum that you can do it, because exercising in a frail person, again risking himself for again fall during the exercise itself. So the maximum amount of exercise which is permissible for that individual is the exercise that is to be encouraged. I hope so. And the dietary supplementation already given, that will strengthen the muscle mass and bone health will be improved. Calcium should be supplemented in adequate doses. So it is all known by all endocrinologists. I don't need to again highlight the doses of vitamin D. What is adequacy, what is deficiency is already known. Then elderly people, apart from this osteoporosis, with concomitant presence of this osteoporosis, we have to have a detailed medical history, because polypills are a accompaniment in elderly people for certain many other reasons, maybe for some comorbid conditions, maybe for other conditions like patients usually have some kind of dementia in the elderly, and sleeping problem will be a problem, and sleep encouraging medications prescribed by many people or antipsychotic drugs usually have many other problems, and they will help in the imbalance while walking. That imbalance, loss in the muscle mechanics, is all the more is also very important, and we have to highlight the treating physicians that these are things to be highlighted too. And again, even if I give an example in elderly, supposing a hypertensive patient, elderly person, being prescribed certain antihypertensives like beta blockers, supposing they usually cause some giddiness in the elderly. These detailed history should be taken from the patient so that they can modify whichever is possible. So I think exercising, good nutrition, avoidance of all the medications that can cause imbalance, because person is already in the imbalanced state and it is already weak because of all the reasons cited, and the ultimately we have to treat the cause of osteoporosis. Like in the females, post osteoporosis, like those things should be accounted for also. As Thomas has already highlighted, we need to focus on the cause of the cause for this osteoporosis. Aging, I cannot prevent. So I think that like this we can prevent, and I think most of this will be supplemented by my co-panelists. I think. Thank you so much.
Thank you, Dr. Singh, for the answer to that question. We were talking about precautions to prevent fractures. So he rightly mentioned that many of the people have a very unsafe home environment. To change that home environment is very important. These are easy methods. So a person, even if he has osteoporosis, if he doesn't fall, at least we can prevent many of the fractures. So that is very important. Thank you for that. I'll go to the next question. Probably people have most doubts about this question, and they would always want to know what dietary changes we need to do to prevent or either treat osteoporosis. So that question is to Dr. Debrati, please. Dietary changes to prevent and treat osteoporosis.
As has been already discussed by this esteemed panel, we need to intake our calcium and vitamin D adequately, and adequate calcium and vitamin D intake in patients, particularly who are at higher risk for development of osteoporosis, will help in the long run. But among the diet which is important for osteoporosis, यूजुअली वैसा कोई डाइट नहीं है, बट हम लोग जो बोलते हैं कि जो चीज़ में ज़्यादा कैल्शियम और विटामिन डी हो वो डाइट में लेने से दवाई में वो चीज़ देना कम पड़ सकती है, और उसमें एडवांटेजेस भी हैं, क्योंकि द मोर अमाउंट ऑफ इनटेक ऑफ food containing calcium and vitamin D will reduce the intake of the tablets containing vitamin D and calcium in their dosage, and उसमें कोई भी calcium related जो side effects हैं वो less होंगे. So usually the amount of milk that is necessary to be consumed to meet a daily requirement of calcium of around 1200 milligrams. So 1200 milligram के लिए at least 1 liter, 1 liter milk consumption बहुत ज़रूरी है, जो क्योंकि कोई भी adult population या फिर बच्चों में भी बहुत difficult होते हैं. So we ask them to eat more amount of other things, other dairy products like cheese, particularly Parmesan cheese, yogurt, even small seeds like poppy seeds, sesame seeds, oily fish and fleshy fish like salmons, sardines, even nuts like almonds अगर आप लेते हो तो इसमें भी कैल्शियम एंड विटामिन डी कंटेंट्स होते हैं. मीट लिवर, एग योक जो नॉन वेजिटेरियन है वो ले सकते हैं. ग्रीन्स में स्पिनच भी calcium content होते हैं, but there is sometimes a material like oxalate which interferes with the intestinal absorption of calcium, so वो भी ध्यान में रखना पड़ेगा. And apart from this, drugs which are very commonly associated with some degrees of hypocalcemia and some risk factors for osteoporosis, जैसे कि लूप डायरेटिक्स, furosemide हम बहुत commonly prescribe करते हैं. Then you have steroids which have already been discussed. कोई भी form of steroid inhalation लो, लगाने के लिए लगाओ, और या फिर you take the tablets, they also have a higher risk if we consume it or take it for a period of more than 3 months. ड्रग्स को अगर एंटी कन्वल्सन बहुत मेडिकेशन है जैसे कि फेनिटोइन, दे आर कॉमनली यूज्ड फॉर ट्रीटमेंट ऑफ कन्वल्शन. सो ये सब कंडीशंस में भी ये ड्रग्स भी इंटरफेयर करते हैं कैल्शियम विटामिन डी एब्जॉर्प्शन में. सो इफ इट इज पॉसिबल, और एंटी साइकोटिक ड्रग जैसे अभी डॉक्टर ने मेंशन किया, इफ इट्स पॉसिबल टू सब्स्टिट्यूट दिस ड्रग्स, प्लीज आस्क योर endocrinologist about that and other physicians who are treating you. If the drugs can be changed, that will be helpful. Exercise already has been discussed, and apart from this, कोई भी अंडरलाइंग डिजीज प्रोसेस हो जैसे कि हाइपोगोनाडिज्म, जैसे कि हाइपर पैराथायरॉइडिज्म जो अभी डिस्कस किए गए हो, रूट कॉज को ट्रीटमेंट करना अपार्ट फ्रॉम डाइट एंड रेगुलर एक्सरसाइज करना इज वेरी इंपॉर्टेंट टू अवॉइड हैविंग ऑस्टियोपोरोसिस.
Thank you, Dr. Devrati. She has mentioned quite a good number of dietary modifications which people can try to increase their calcium intake. If I am not mistaken, dietary calcium is very safe for people as compared to the calcium tablets. Calcium tablets are also safe, but people who have renal stones, maybe dietary calcium is better than the medication, calcium being prescribed as a medication. So these foods which contain high amount of calcium, people should know. They should know how to modify their diet accordingly. Some people may be vegans, some people may be pure vegetarians. So Dr. Devrati has given options for everyone. So hope you will all listen to her regarding this. And final question to the panelists is to Dr. Thomas Paul, sir. This is a very important question. It has got a great public health importance. So with that question and a final wrap up of all the previous discussions, I would like to hand it over to Dr. Thomas Paul, sir. The question to you is, how do we screen for osteoporosis, and are there any tools available to screen for osteoporosis?
Thank you, Dr. Vishnu. Once again, it's a very relevant question. See, there are certain diseases we do treat as the age goes, advances. One such disease is diabetes. We all should know, like about 20 years back, nobody was talking about diabetes as a risk factor for fractures and osteoporosis. Now we know whether a person has type 1 or type 2. So these are the factors, risk factors, which will help us to say whether we are at increased risk of osteoporosis. At a screening level, at a primary level, like in a village, one lady comes to, or in your home, somebody is there. There are some tools, some formulas which can help. One such formula is OSTA. What is OSTA? Osteoporosis self-assessment tool in Asian. Very simple. Very, very simple. Only two things you have to know. One is weight. Number two, age. So how do you know what is the calculation? Weight minus age multiplied by 0.2. For example, somebody weight is 40 kilograms, age is 60. So weight minus age is equal to minus 20. Into 0.2, we know it is minus 4. If somebody has a score of less than plus 1, that is in this minus 4, they are at a high risk. Then we know this person may have osteoporosis. Second such tool at a little higher level is a online, like you can do it in a smartphone, called fracture risk assessment tool. That is, you can say there are so many risk factors. If you put flags in Google, it will open up. You can put an Indian flag there, you can choose, and it will have so many risk factors. We have to write yes or no. It will give us an idea whether what is the risk of I or he or she sustaining a hip fracture or any major osteoporotic fracture. There we can also have a provision to substitute diabetes, because that is very important. As the age advances, many people have diabetes. So these are the simple tools we can use in the clinical practice, or at a primary. Anybody can use it. Anyone can use it, and they can approach the physician, endocrinologist, for further consultation. I will ask Dr. Vishnu to wrap up, but I'll say at the end of it, it is osteoporosis. We should be aware. 40 to 50% of the postmenopausal women have osteoporosis in India. We have to make a diagnosis early, because the treatment is so much rewarding. The treatment is very cost effective. It means taking care of the diet, taking care of the activity, physical activity, fall prevention, as the course panelists spoke about adequate activity and adequate nutrition pertaining to calcium and vitamin D, and specific medication to treat osteoporosis as per consultation with the local physician or endocrinologist will be very rewarding in preventing fractures. So everybody should be screened. Every lady, every woman above 55 years should be screened. So we don't even wait for 60 years, because Indian women, the menopause little early, 45 to 46. So they are at risk. Over to you, Dr. Vishnu.
Thank you, sir, for highlighting the importance of screening for osteoporosis and the simple tools which we can use even without the doctor's help. You can download the app in the smartphone and just look at how in next 10 years or so, what is the chance for you to get a fracture. So if that is there, you might want to consult a endocrinologist or a physician who is well versed with osteoporosis for further management and investigations. So thank all the panelists. I would like to wrap up the session. Before that, do we have any questions? Yes. So we have some questions in the chat box. I think one question is bisphosphonate recommended in osteopenia in postmenopausal women, T-score of minus 1.6, or only calcium and vitamin D supplements are sufficient in osteopenia? So this, I am sure it is a question from a doctor. We have not discussed about the term osteopenia here. Osteoporosis, we have highlighted that term only. The medical definition of osteoporosis is different from the general idea which people get from the term osteoporosis. But I would like to say that osteopenia is a lighter form of osteoporosis, and people who are progressing to develop osteoporosis soon, they will have osteopenia. So I would ask Dr. Pradosh, sir, for giving an answer to this question. Would you treat a person with osteopenia in a postmenopausal woman with a T-score of minus 1.6? Only calcium, vitamin D, or bisphosphonate?
Thank you, Vishnu, for asking me that question. The problem is the osteoporosis, that cutoffs and differentiation. If you take many of our postmenopausal women who develop fractures, most of them have osteopenia rather than osteoporosis. So just osteopenia itself doesn't say that they are not a candidate for treatment, you have to assess the risk for clinical risk factors for fracture in that particular person. It's bone mineral density is just a one set of definition to identify and diagnose osteoporosis. But if the patient has fracture risk assessed by different scores, as Professor Thomas Polzer mentioned, FRAC score, there are multiple Q fracture. There are different scores by which you can assess the fracture risk, and even there are simple tools to assess the fracture risk. Clinical factors you just assess by clinical analysis, and if there is previous history of fracture or fragility fractures for that person, or any parents with family history of fractures, then we have to consider the treatment. Anyway, we have to look for the other reasons for and vitamin D deficiencies and all these easily correctable causes we have to consider. But if the patient has increased risk, it's now an indication to consider treatment. But that depends upon the other factors, whether patient had fracture, fragility fractures in the past, and based on that you may have to decide. It's not a simple query, but you have to consider multiple factors. I like to hear from Professor Thomas Polzer, his comments.
You covered it actually, and it is very true. Minus 1.6 plus risk factors or past history of fragility fracture qualifies for treatment. And we can do this in FRAX also and see the risk, then we can. And diabetes, you may be in osteopenic range. Still, you may have to consider treating.
So thank you, Pradosh sir and Thomas Paul sir, for giving the answer to that question. I think we have covered most of the points in osteoporosis. This topic is so much important that even after fracture, people don't get the proper evaluation and proper treatment. So we are talking about screening for osteoporosis, but even after a secondary fracture, I am sure many people still don't have access to investigations, proper investigations, and many of them we can't just think about just you. If you want to remember about this, there is one point that osteoporosis is to fracture what hypertension is to heart attack. So you just cannot imagine a person who has heart attack not getting any treatment for hypertension. But in our country, many people who already has 1 or 2 or 3 fractures, they are not being evaluated for osteoporosis and they don't get proper treatment for osteoporosis. So this condition has to be changed, and we as practicing endocrinologists have to take a lead on educating other doctors, other even patient support groups, and we have to try to make this more prominent and important in our practice, so that our country now we have a young population, and we will all be aged very soon, and along with that we will have a huge number of patients who are more than 50 years, 60 years, who will need evaluation and treatment. So by that time we as a country should be ready to face the huge problem of osteoporosis. And thank you, the panelists, for your time, precious time. I thank all the listeners and Endocrine Society of India for giving us the opportunity. Thank you all. Good evening.
Thank you.
Thank you. Thank you.
Yeah, thank you.